Good morning. I'm Janie Parrish with the Wadsworth Area Chamber of Commerce, and you are zooming into business with two of my very favorite people from the Free Clinic of Medina County. So we have the medical director and president of the board, Dr. Kim Bowen. Wave to us, Dr. Bowen. There he is. Okay. And then also we have the executive director, Nancy Peacock. So good morning, Miss Nancy.
Thank you. Morning.
Yeah. Now, this is a very near and dear to my heart, the Free Clinic. I'm on the board of the Free Clinic, and every time we get together, I'm amazed at what the Free Clinic does. So we're going to let all of our people here in Wadsworth know exactly what the Free Clinic does. So, Dr. Bowen, you started this in Medina for Medina County. So tell us about the Free Clinic of Medina County.
The Free Clinic of Medina County originally was set up to help people that were working but were not insured and lived in Medina County. From a personal point of view, I was an ER physician for 30 plus years, and I used to get very frustrated because we would see people that were on Medicaid or on Medicare or on some type of public assistance, and they were getting all their care taken care of and paid for. But the guy next to them was working two jobs, didn't have insurance, and his money he'd have to pay out of pocket for all his health care. We expanded our program this past year, mainly because of response to the COVID virus. There are a lot more people are losing their jobs, and we just felt that we needed to respond to that.
So the board made the decision to open it up to meet different criteria.
Yes.
Yeah. And so what's that new criteria?
The new criteria is that you have to live or work in Medina County and be 250% above the poverty limit. The reason we have that stipulation on the money is that we utilize different hospital services, whether it be Cleveland Clinic or UH or SUMA, and that criteria helps them fit within the hospital system criteria, so they do not get charged.
Oh boy, yeah, and it's so needed. You know, I was a single mom for a long time, and boy, when you have to make a decision between getting medical care, preventive care, or even you got a sore throat kind of thing and worried about it going into strep, and it's like, do I pay the house payment? Do I get myself taken care of? Yeah. So, and it should never be like that.
So wrong.
It's
so bizarre that in a country with our wealth that we don't have a better system for medicine.
That's true. Now, Nancy, there's a new program that came up with the Free Clinic that we're all very excited about.
Yes, it's actually a program that was born from your husband, who is a teacher in the Buckeye system, and he was good-hearted soul that he is. He was actually paying for some kids' physicals in order for them to get a job or to join a team. And so you came to the board and said, look, can we do free physicals? And we kind of discussed it and figured out, yes, we can. And one thing that is so important is that you think, well, some kids have insurance. Well, some kids do have insurance, but that insurance only allows you one well visit a year that is covered. So if you have to go back for another physical, as in one of our patients is, you have to pay an additional $180. And that's just too much money to join a bocce ball team. So what we decided was we were going to help these kids achieve their goals. And in the process, make our clinic more visible to everyone in Medina County.
And that's pretty exciting. Yeah, because we never want there to be barriers between somebody that needs to get a job, would like to get a job. And then, but here's this physical that stands between them and getting employment. So that's pretty cool. Now, who takes care of the people that come to the free clinic?
Doctors and nurses that volunteer their help. We have a pharmacist that volunteers as well. We have people that volunteer that are not medical people as well. This is a very much a community-based program. It's not owned or run by Cleveland Clinic or SUMA or UH. It's developed on a grassroots local basis, and it continues to run on that.
And all of the doctors that volunteer, they're well-established community doctors. And I know some have retired and and I've heard them say so many times, and I love this, that this is the way that they always wanted to practice medicine, was at the free clinic, where they have the time and just everything about it is what they went to medical school for.
Yeah, Janie, that's so right on target. That's both for the doctors and the nurses. I mean, you're able to spend as much time as you need to teach someone about their medicines or about what's going on with them. There are some doctors that only see 2 patients an hour, but they love it because they can sit down with that patient and really explain everything. And that's the way you were ideally taught in medical school. It was always about the patient. It wasn't about how many you saw or what test you ordered for them or whatever. It was just about the patient and taking care of them.
Oh, I love that. Now tell me, both of you, why do you love what you do? Because you do, and I know that.
Well, we do. I mean, I was a journalist for most of my career, but the bedrock thing about being a journalist is that you love helping people and you love connecting people to resources. So when I heard about the job, although I didn't have a medical background, I wanted to be the communicator that could help the community know about us, because this is a group of seasoned, kind, caring people who have the resources to help them stay healthy. And a lot of that just goes down to convincing people that we exist. It's like, it's too good to be true. That can't be. And we do exist, and we are real, and we're always looking for new patients.
Dr. Bowen, why do you love what you do?
Yeah, this is the way it should be. You know, I used to get so frustrated as an ER physician because you'd see people that weren't getting care because they couldn't afford it. Or the other thing is, provides preventative care. So they don't end up in the ER and they're having their heart attack or they're having their stroke. This helps so that that does not happen to them. Sometimes I feel like we're a bunch of little Dutch boys putting our finger in the dike. But at least it's one little thing, and we're very small, but we're still helping the community. So that's okay by me.
Now, how can people find the free clinic of Medina County?
There's a couple ways. If you are able to navigate a computer, we have a lovely website, which is FCOMC for Free Clinic of Medina County.org. So all you have to do is go on there, and it's a blueprint for how to get a hold of us, how to call us, to see what we offer. And that's a great way. If not, just give us a call at our main number, which is 330-764-9900, and leave a message if we happen to be on another line. We will definitely get back to you. We want to help you stay healthy, and we will turn heaven and earth to make that happen.
Just want to correct Nancy on one thing. The actual number is 330-764-9900. 9,300.
What did I say?
9,900, I think.
Yeah, that's okay. Yeah.
Sorry.
Sorry.
Now, where is the clinic located?
It's located in the North Medical Building of Medina Hospital. So if you're looking at the hospital, we're to the right side, you go down that hill, there's a huge parking lot, and you go in entrance D of the North Medical Building, and that's where we are in Suite 104.
Oh, the clinic is just so nice. It's so professional and it's warm, it's welcoming, but you also have a Lodi site as well.
Yes, we do. And we have that, what was it, once or twice a month?
Yes.
Something like that. And we open up to people in this area down here in the Lodi area.
So if you want to schedule closer to home, we're able to do that for you.
Well, I have to tell you, I feel so blessed to be part of the Free Clinic of Medina County. I'm always amazed at the amount of hours that our doctors and nurses and volunteers put in, and how they truly have it in their hearts. And so, and thanks to both of you for all that you do, and because you've been the steering of the Free Clinic, and we're excited about the physicals, and it's just there's no stopping now. Yeah.
As our treasurer, Phil Brewer, says, other than my family things, it's the most important work I've ever done. And I think we all feel that way.
Yeah, absolutely. Well, Dr. Bowen and Nancy Peacock of the Free Clinic of Medina County, thank you so much for all that you do, and thanks for visiting with us today.
Thank you.